Getting dental work done can be intimidating, so our sponsors at Buffalo General Dentistry do everything they can to make their clients comfortable and send them off with a smile. Take a look at my visit to their clinic. Well, today we're here at Buffalo General Dentistry and with Dr. Daniel Jamal. Thank you so much for having me.
Thank you for coming. We're so excited to have you in the office today and share a little bit about what we do with you.
Yeah, I want you to tell us a little bit about your practice and everything you do here.
Absolutely. We're a general dental practice. We do provide general dental services, but we've kind of become known for a procedure called Teeth in a Day. It is amazing. We have done so many of these and they never get old. They are so transformative for patients. Essentially, it's a procedure where you can come in under sedation. You can snooze through your appointment and wake up with a brand new set of teeth connected to dental implants.
Nice. And you were telling me that you kind of have the system to make it work. It's all pre-planned out, the procedure, right?
Right, correct. We are a completely digital office, which means that there's very minimal need for the goopy impressions of the years past. Everything is done on the computer before we see you. Okay, so you'll come in, we'll meet you, we'll listen to what your wants and needs are. Of course, we'll go over many different treatment options with you, and ultimately you'll select what's right for you. If you do decide that you want dental implants, then we'll start our diagnostic phase, which is when we take our 3D x-rays and digital scans, and we'll actually do the procedure on you on the computer before you're even in the chair. It's pretty remarkable. The technology is cool and it really never gets old. But more importantly for the patient, what it means is that your procedure is going to be faster, with less discomfort, and way more precise. So whether we have a good day or a great day here at the office, the implants always go in where they're supposed to go, with the best chance of success.
Nice. Now, we talked a little bit about dental implants, which is what you guys do here, but you also do so much more. So walk me through what it's like if I, myself, for example, was a patient coming in for the first time to see you and figuring out what my needs are.
Yeah, absolutely. We designed this office around the feeling that we felt was missing in dentistry, where people used to know who their dentist was, and there was that personal touch in dentistry that's so important, because so many people are so afraid to come into the office, no matter how nice we are or how fun we think we're making the office. It's just not everybody's favorite place to go. So when you come in, you'll meet our care coordinator, who will walk you through the office, give you a tour, and have a little mini interview with you just to understand if you have any dental fears or what it is exactly that brings you into us today, how you found us. Get a little information. So before we even sit you in the dental chair, we're getting to know you a little bit. Then we do a full comprehensive evaluation of your teeth, and the question I always ask patients, even though I have probably gotten the backstory from the care coordinator, what is it you'd like me to do for you? And I think what makes us different in the office is that I consider us all to be great listeners first. We want to hear what your wants and needs are, what your expectations are, and really understand where you're coming from before we start presenting you treatment options.
You really do make it feel kind of like a home in here, making people feel as comfortable as possible. We talked about that. Yeah. A little bit of anxiety for a lot of people when they come to the dentist, yes. But when you come here, you even have some artwork on the wall that just make people smile. Do you want to tell us about that?
Absolutely. You know, we want to connect with the local community, and we really want to take the fear out of dentistry in as many ways as possible. That's from the way we interact with patients to the fact that we do offer sedation, but little touches along the way. We had local elementary students submit artwork to us, and we turned our main hallway into an art gallery for them. I can't tell you how much joy it brought our patients just to pick the one they liked the most. They all look very playful and colorful, and it just brightened people's day where they would otherwise be really fearful and tense about coming in. It kind of let the steam out of the appointment. To top it off, we had a fun event with those kids where we invited them and their parents and of course their art director, and we hosted an art show, and a showing for them basically, where they could really feel like the stars of the night, and they did. It was a lot of fun to see them light up and find their paintings or artwork on the wall. And you know, it was a fun event to connect with the community. So we'll definitely be doing more of that. So stay tuned for the next exhibit, which is coming soon.
Okay, and let's talk a little bit about the technology you have to offer. It's pretty cutting edge.
Yeah, it's cutting edge. We're really proud of our technology. you know, everything that we've done for the office is around the patient experience and really to maximize everyone's chance of getting the outcome that we're aiming for and the outcome they want. So digital dentistry is where things are today, and that's exactly where we've gone. So let's just say you're an implant patient, you want to come in. We take a series of 3D x-rays on you, and even before you come in for your procedure, we will have already done that procedure on you on the computer. And it's pretty remarkable. It doesn't get old. It's really neat. We have a series of templates that we can use that are already pre-made for you when you come in, and that means your implant goes in faster with the utmost precision and minimal amount of discomfort.
Well, Dr. Jamal, thank you so much for having me. I know that you're going to do a little work on me. We'll see my scans, right?
Yeah, exciting. You're going to get to test out our newest scanner, the iTero 5. We use it for Invisalign. We use it for those pre-planning procedures that we do. It's painless. There's no goop. I think you'll like it. Okay, so we'll start on the lower, so you can open nice and wide. Great. And as we scan, you'll see your teeth show up on the screen. So we do a scan of, like, let's say she was missing a molar, right? We'll take a scan like this of the teeth, and then we'll take a 3D x-ray. Then we go behind the scenes. Both of those 3D images merge on the computer, and we can actually plan where the tooth is going to go. We can see where the good available bone is. So this would be what we'd consider to be like part of the diagnostic appointment. Painless, quick.
I can attest, I'm not in pain.
Right? Doesn't hurt. So gone are the days of the goopy stuff. So there's your upper and your lower.
There's my chompers.
Those are your chompers.
All right, viewers, if you are looking for a dentist, we found one for you right here at Buffalo General Dentistry. Thanks so much for having me.
Thank you, Chelsea.
If you'd like to book an appointment with our sponsors at Buffalo General Dentistry or learn more about all of their services, you can visit buffalogeneraldentistry.com or connect with them on Instagram.